Welcome to Meet the Docs with your host, Grant Otten, brought to you by Columbus Community Hospital.
Hey guys, welcome to another edition of Meet the Doc, sponsored by the Columbus Community Hospital. Dr. James Friedlander joining me today. Doctor, how are you?
How are you? Nice to meet you.
Nice to meet you too. And we are, I've been dealing with a little allergies recently too, but you're an allergy doctor, so fitting that we get to talk right now. But
it's the allergy season, so
it is.
This is a good time to meet.
Yeah, you've been busy. What is some of the common stuff you've been seeing coming in here, or what?
So really in Nebraska, we have two main allergy seasons. The first one starts when the weather warms up, usually in March, and that just about ended a couple weeks ago. Little break in July, and then August starts ragweed season, which is another tough season, especially for people out in Columbus and some of our more rural communities. And then we get a little break in winter, and then it starts up all over again.
Well, we're out here in the Visiting Physicians Clinic, so how often are you here in Columbus?
We started this clinic about 5 years ago. It's been almost 5 years, and we started just once a month, and now we're going every other week, and soon to be every week.
Wow,
so there's a lot of people out here with allergies.
Yeah. Well, that's awesome that you're here. What is it that I guess kind of got you into this field? Was there something specific?
Well, I grew up in Omaha, and I always wanted to go to medical school. I initially did pediatrics, and after that then did allergy out in Boston, and then decided to come back home about 18 years after I left. And shortly after coming back to Omaha, we started coming out to Columbus. There was a need in the community, and we've been just really fortunate to be here.
You talked about 5 years now. A lot has happened here at the hospital in 5 years. What has it been like seeing the transformation?
There's been a lot of growth. I mean, first of all, just the clinic and the facilities are just incredible. And, the people have been wonderful. And we're seeing a lot more specialties and than certainly than were there 5 years ago. So lots of growth at sort of all angles.
And you talked about studying kind of different places and seeing probably a wide variety of populations to deal with. Do you think that affected maybe or improved what you're able to provide today, or what was that experience like?
When you think about an allergist, you think, oh, well, I'll go to him if I have allergies, but there's a lot of other things that we do. In addition to hay fever or seasonal allergies, we see patients with asthma, patients with skin allergies like eczema, food allergies, people with drug allergies, and then if I take off the allergy hat and put on the immunology hat, we're also immunologists. And so we see people that have recurrent infections, recurrent sinus infections, recurrent pneumonia, people that get sick too much, and these are kids and adults.
Do you think that maybe helps you as a doctor being able to work with all these different types of patients at different levels to handle maybe something new when it comes along, or does it?
I think it does, and I think it keeps it keeps the doctor's interested as well. Lots of different conditions to see and treat, and it's nice to have a variety.
Recently spoke to hospital staff about some allergy stuff. Being able to talk to staff and being seen as maybe that allergy expert. Obviously, it's what you are specific in. Is that kind of a cool honor to be able to talk to them about that? But
that's
also
right. We did a food allergy talk recently, a few months ago. Food allergy is a really exciting topic these days. There's lots of new emerging treatments for food allergy, and I thought it'd be a good idea to sort of share some of the knowledge, specifically with peanut allergy in particular, which is unfortunately very common.
And so you're seeing kind of an increase in food allergies. What's kind of the common, or what are some common things that people come in? You mentioned this earlier, but is food allergies among those that you're seeing a lot of these days?
So we see a lot of food allergy. We see a lot of seasonal and perennial allergies, so allergic rhinitis, lots of asthma all year, and lots of people with recurrent infections.
Dr. Friedlander, thank you.
Thank you very much.
And thank you guys for joining us as well for another Meet the Doc sponsored by the Columbus Community Hospital. We'll see you next time.